Female genital mutilation, or FGM, is child abuse. Over 100,000 women have been subjected to female genital mutilation in the UK. A vast majority of these victims would have been subjected to this form of abuse either before they came into the UK, or they would have been taken as children to their parents' country of origin to be subjected to this form of abuse. The purpose of this training course is to ensure that practitioners understand what female genital mutilation is. To ensure that practitioners may be confident in identifying those children most at risk of FGM. To ensure that practitioners feel skilled in protecting potential and actual victims of FGM. To ensure that practitioners understand issues relating to prosecuting perpetrators of FGM. So what is female genital mutilation? It is defined as the World Health Organization as all procedures that involve partial and total removal of the external female genitalia or other injuries to the female genital organ for non-medical reasons. The WHO offers 4 classifications of FGM. Type 1 usually refers to the removal of the clitoris and clitoral hood. Type 2, excision, is the removal of the clitoris and inner labia. Type 3, most severe, infibulation involves the removal of all or part of the inner and outer labia, and usually the clitoris, and effusion of the wound. A small hole is left for the passage of urine and menstrual blood, and the wound is opened for intercourse and childbirth. Type 4 refers to miscellaneous procedures such as symbolic piercing of the clitoris and labia, cauterization of the clitoris, and cutting into the vagina to widen it. FGM is typically carried out between 4 years old and puberty, although it may be conducted on infants and adults. It may take place in a hospital, but it is usually performed without anesthesia by a traditional circumciser using a knife, a razor, or a scissors. The practice is rooted in gender inequality, cultural identity, modesty, status and honor, and an attempt to reduce women's sexuality by controlling and reducing their sexual desires, thereby promoting fidelity and chastity. Around 85% of women who undergo FGM experience type 1 and type 2. It is mainly practiced in 28 countries in Western, Eastern, and Northeastern Africa, particularly Egypt and Ethiopia, and in parts of Asia and in the Middle East. WHO estimates that there are 140 million victims worldwide. A government study found that nearly 66,000 women affected by FGM are living in England and Wales. The study also found 16,000 girls under the age of 15 are at high risk of type 3 FGM, and over 5,000 are at high risk of type 1 and 2. So what are the consequences of FGM? Immediate complications are increased when FGM is performed the traditional way without access to medical resources. It is extremely painful and can be fatal. Other immediate complications include acute urinary retention and infections. According to a recent report, it is unknown how many girls and women die from the procedure, as few records are kept. Complications may not be recognized and fatalities are rarely reported. FGM may complicate pregnancies and place women at high risk of obstetrical problems. The WHO estimated that an additional 10 to 20 babies die per 1,000 deliveries as a result of FGM. Victims typically report sexual dysfunction and painful sexual intercourse. Psychological complications are related to cultural context. Damage may occur when women who have undergone FGM move outside their traditional circles and are then confronted with the view that mutilation is not the norm. So what is the role of child protection and safeguarding workers? FGM is child abuse. If you suspect that it has happened to a child or is going to happen to a child, You have a duty to report it in exactly the same way as you would report any other suspected case of child abuse. FGM is illegal in the UK, and it is illegal to take a child from the UK overseas to be abused in this way. To see the laws relating to FGM in the UK, you should refer to the written components of this course. So where is FGM more prevalent? Let's have a look at this map to see in more detail.
So how do you identify a potential victim of FGM? The place to start is with midwifery services, because sadly, a mother who has been through FGM herself is statistically more likely to put her child through FGM. So work with your midwifery services to identify mothers who are victims of FGM who have female children. Then work with health services to talk to the family and identify their attitudes towards FGM and whether you think it is likely that this family will put this child through FGM. If you believe that it is likely, then you must hold a professionals meeting. You must decide the level of risk with the family and the action that you must take to protect the child. If the child travels overseas while you are in this process, you must hold an urgent strategy meeting. You must look at where the child has gone, and you must make plans to investigate upon the child's return. If you have identified a child who you believe has been taken abroad and made subject to FGM, then when they return to this country, you must hold an urgent strategy meeting. At that strategy meeting, social services, school, health, police and the Crown Prosecution Service must decide how they are going to conduct the investigation in order to protect the child and gain best evidence for prosecution. Ideally, social worker and police will visit the family home and will investigate. They will question the parents, they will talk to the child separately, and based on the outcome of those conversations, you may decide that a child protection medical is called for. It may be that the parents do not allow permission for a child protection medical. You can, of course, apply for a court order to enforce a child protection medical. The medical will show whether FGM has occurred or not.
In the aftermath of FGM investigation, there are several factors to consider. A victim may not wish to leave their family home, and other than the FGM abuse, the family may be an appropriate placement and the child may be at no further risk. If there is a prosecution of a family member, then the risk to the victim must be continually assessed and the victim must be supported. Victim care is vital as the child's mental and physical health may be at risk, and both must be urgently addressed and supported. FGM is child abuse. You have a duty to investigate. Victims may not disclose or come forward. Proactive identification and a multi-agency approach is vital.